Hello, and thank you for joining me today. My name is Laura Copeland, and I'm an advanced nurse practitioner within NHS 24. I wanted to start by sharing a bit about why this project means so much to me, not just as a clinician, but as a member of a team which is passionate about making a real difference for patients and families across Scotland. When COVID-19 pandemic hit, so much of what we took for granted in healthcare changed overnight. This project is not just about the numbers or policies, it's about the real people, real challenges, and the drive to improve every patient's journey. In this presentation, I'll walk you through our aims and the methods we used and the outcomes we achieved. I hope you'll see not only the data, but also the passion and commitment that went into making remote prescribing a reality once again. Over the past year, I've worked closely with colleagues, internal and external stakeholders across NHS Scotland. Together, we've asked tough questions as to how AMPs within NHS 24 can make a real difference. How do we ensure that patients and their families get the right care in the right place at the right time? As an AMP, we're expected to be skilled in everything from history taking and clinical assessment to diagnosis, investigation, and prescribing. But to be truly competent, we need opportunities to practice these skills in the real world setting. That's why, for over a year, we've worked to align our roles within NHS 24. We've updated policies and procedures so that we can launch this test of change. It's been a journey of collaboration, learning, and at times creative problem solving. For me, the aim of this project was always clear. I wanted to see what impact reintroducing remote prescribing would have, not just for NHS 24, but for our out of hours partners, and more importantly, our patients. As a team, we were determined to make this a true quality improvement project, working in collaboration with our video consultation test of change. Working together with the VC project, we wanted to provide safe, effective prescriptions for children aged 2 to 12 and see if this initiative could genuinely improve their journey through our service, whilst also reducing the burden on the out of hours service and not detracting from the fantastic resource that's available in the community, such as Pharmacy First. At the heart of all was a simple question: can we make things better for the families who rely on us? When talking about the methodology, we used a plan, do, study, act approach, which really resonated with me as a practical, hands-on way to drive change. Over 8 weeks in May and June in 2025, we focused on children aged 2 to 12 who came to us via the internal NHS 24 line. We were given the option if we wished to invite those patients in for a telephone triage, if we deemed it would be helpful. When appropriate, we provided them with remote prescriptions. From the results, we handled 309 calls during this test of change period. 7% of patients received a remote prescription. Nearly half of those prescriptions were for throat-related conditions. A reminder of how common these issues are for families, really. Most strikingly, 95% of patients who received a remote prescription would have needed an out-of-hours appointment if our AMP service had not been available. That would have a huge impact in the out-of-hours, and it's something we're generally proud of, that we were able to negate those patients away from onward journeys. We've seen some real evidence of improved patient journeys and a reduction in referrals to the out-of-hours, as I've just discussed. Behind every statistic is a child who got the care they needed, a parent who felt reassured, and a team of clinicians who worked hard to make this happen. We have some recommendations from what we've learned. If we were to broaden this project to include healthcare professionals within NHS 24 who have clinical assessment and prescribing qualifications, would we become more flexible and responsive to the needs of our patients? What impact can we have on pharmacies? Hearing their real-time feedback would be invaluable. We need to keep supporting our prescribing AMPs. gathering feedback on their experiences and the economic impact of our work. Looking ahead, can we extend this and include adult patients? Can we grow that impact, reducing those patient journeys and preventing onward referral? Finally, as a recommendation, I'm convinced that working with all Scottish Health Boards to develop a national out-of-hours formulary would make life easier for clinicians who work across boundaries and ensure equity for patients, no matter where they live. We have some plans of action. Throughout this project, we have seen the value of regularly reviewing our policies and procedures to keep quality high, and that will continue to happen until we're happy with the outcomes. Supporting each other through peer mentoring and case-based discussions, and to be honest, some of the most valuable learning has come from these conversations during this test of change. It's important that we maintain strong clinical supervision with a buddy system on shift that also includes medical and pharmacy colleagues, and always seeking feedback, both internal and from our service users, so that we can refine and improve what we do. Working as an advanced nurse practitioner within NHS 24 is both challenging and rewarding. We operate nationally across 14 health boards, and every change we introduce has to work for a diverse range of communities. This project started small, focusing on paediatrics, but it's already shown how much we can achieve when we work together, stay focused on our patients, and never stop learning. Thank you for letting me share this journey with you. I hope you can not just see the data, but the passion, commitment, and teamwork that brought remote prescribing back to life for the families who need it the most. Thank you.